This second presentation regarding health inequalities affecting vulnerable migrants briefly outlines some of the barriers to this group accessing equitable healthcare and some of the specific health needs that may need consideration. There are a number of key barriers to healthcare for vulnerable migrants. Firstly, registering primary care. The charity Doctors of the World report that they assist around 2,000 people in London alone per year who have been unable to access primary care services. Many of these are vulnerable migrants, often prevented from registering with a GP by administrative, language, or other barriers, including being moved around at the very short notice. Whilst there are many reasons why identification and proof of address are helpful in registration, it is not an essential criteria and should not prevent someone from accessing care. Documents are often difficult for asylum seekers and refugees to provide, as they may never have had any in the first place. Things may have been lost en route, or certain documents may have been given to the Home Office. Secondly, understanding the NHS. Many countries operate a very different health system, and primary care may be particularly poorly understood. This may result in lack of registration, disjointed care, missed appointments, avoidable emergency presentations, and inappropriate use of emergency services. Thirdly, language and translation difficulties. As per other minority groups, language barriers may cause problems with registration, booking an appointment, or accurately describing their health needs. It is the responsibility of the practice to provide an appropriate translator at every step of the patient journey. Fourthly, poverty. Asylum seekers are paid a very small allowance because they are not allowed to work, but it can be very difficult to manage the demands of food, prescriptions, sanitary products, transport to medical appointments, and phone credit. As such, they are at risk of health problems that are linked to poverty. Fifthly, many asylum seekers and refugees are isolated from both family and social groups. They have a lack of information regarding support and face negative portrayal in public discourse and media. They may also fear deportation and find it difficult to trust authority, which may extend to health professionals if they feel judged or fear transfer of information to the Home Office. They have no say over when or where they may be moved, and therefore life is very unstable and uncertain. The BMA helpfully categorises specific health needs into 4 key areas. Firstly, poorly controlled chronic conditions. Many people may not have accessed healthcare for some time, either due to unstable health systems in their country of origin, long journeys, or delay in seeking care on arrival. Hypertension, diabetes, epilepsy, or badly healed injuries are to name just a few. Secondly, mental health. Depression, anxiety, post-traumatic stress, history of torture, sexual or gender-based violence may result in unmet mental health needs. Extended periods of stress and uncertainty can also lead to a deterioration in mental health, even where there was no prior history. Thirdly, maternity care and contraception. Late presentations of pregnancy, FGM, poverty and malnutrition may contribute to poorer outcomes for mother and child. People may not realise that maternity care and family planning is free to access. Fourthly, untreated communicable diseases. TB, blood-borne viruses such as hepatitis or HIV, parasitic infections or diseases secondary to missed vaccinations may be highly prevalent. In addition, patients will not be aware of screening programs offered in the UK. They may not understand the test, the reason for the test, or when they will be recalled. They may require targeted information regarding screening programs according to age and gender.